In May 2026, a cluster of mysterious, severe respiratory illnesses broke out on a cruise ship. When the pathogen was identified as Hantavirus, the global news cycle went into immediate overdrive. The coverage focused on one highly specific statistic. The strain of hantavirus pulmonary syndrome found in the Americas kills up to half of the people it infects. When we read a 50% fatality rate, we naturally map that onto our recent experiences with fast-spreading respiratory diseases. We begin to prepare for a fast-moving global pandemic. This misallocates our anxiety. We brace for lockdowns and avoid crowds, while ignoring the actual environmental hazards where this virus lives. This panic stems from conflating a high fatality rate with a high outbreak potential. In biology, those are two distinct mechanisms. Ranking a pathogen's threat level using a single monolithic number creates a distorted view of public health risks. To understand the actual risk, we evaluate 3 case studies: Hantavirus, Ebola, and Rabies. Biological danger involves a central trade-off. A virus that kills nearly every host but struggles to spread is less dangerous than a mild virus that infects billions. Understanding the 2026 cruise ship outbreak requires us to pull these metrics apart. We must decouple lethality, how a virus kills, from transmissibility, how it spreads. Hantavirus is primarily an environmental hazard. Its biological structure dictates a very specific, limited path from its natural host to humans. In North America, the primary reservoir for the most dangerous strains is the deer mouse. The virus persists silently within these specific rodent populations. Humans typically contract the virus through inhalation. When dried rodent urine or droppings are disturbed, often while cleaning sheds or cabins, viral particles are kicked up into the air and breathed into the lungs. This infection causes hantavirus pulmonary syndrome, carrying a staggering mortality rate between 35 and 50%. However, the human body is a biological dead end for almost all strains. An infected person cannot pass the virus to others through casual contact or breathing. The Andes strain, which drove the 2026 cruise ship concerns, is the rare exception. It has documented human-to-human transmission, though evidence suggests this requires extremely close and prolonged contact. While hantavirus is incredibly severe for the individual, its reliance on specific environmental exposure makes it an isolated hazard rather than a pandemic threat. Ebola, however, functions as an outbreak catalyst. Its distinct filamentous structure is built for an entirely different kind of movement. Unlike hantavirus, Ebola requires direct physical contact with the symptomatic bodily fluids of an infected person. This human-to-human mechanism allows for explosive localized spread, especially among family members and frontline healthcare workers. The result is massive localized mortality, with fatality rates ranging from 25 to 90%, depending on the medical response. Despite this velocity, Ebola is contained through its own biological requirements. Relying on fluid contact means spread is halted through strict medical isolation and ring vaccination. Ebola is a high-velocity threat, but its reliance on symptomatic fluid contact makes it susceptible to targeted public health barricades. Rabies is the neglected certainty. In this micrograph, you can see the small, rod-shaped viral particles actively colonizing a cell. Transmission requires the virus to enter the body directly, typically through an infected mammal's bite. It then travels slowly up the nervous system toward the brain. The metrics for rabies are absolute. Once clinical symptoms appear, the fatality rate is 100%. However, its human-to-human spread remains at 0. Even with 0 human-to-human spread, the environmental prevalence of rabies leads to approximately 59,000 human deaths every year. Despite being universally fatal if untreated, rabies is entirely preventable through a timely post-exposure vaccine. Rabies proves a pathogen can be the deadliest virus on Earth per case, yet remain manageable. This highlights the flaw in using lethality alone to measure public danger. We can now map these pathogens on a unified danger matrix, placing fatality rate on the y-axis and human-to-human spread potential on the x-axis. Rabies sits in the top left corner, absolute peak lethality but absolute 0 spread. Hantavirus plots very high on lethality, but remains far to the left on the spread potential axis. Ebola remains high on the y-axis, but pushes into the middle right territory due to its capacity for human-to-human transmission. Evaluating a virus against this specific threat profile trades sensationalized fear for a calibrated, logical response. Effective prevention relies on matching your personal behavior to a pathogen's specific mechanism of transmission. Neutralizing hantavirus risk is an environmental task. It requires wearing appropriate protective gear, such as an N95 mask and gloves, when disturbing dusty, rodent-infested spaces. Ebola requires strict medical isolation to break the chain of fluid contact, while rabies demands situational awareness around animals and immediate post-exposure vaccination. Rabies is the deadliest per case. Ebola is the most likely to trigger a localized crisis, and hantavirus is a stealthy environmental killer. The actual danger of a virus is determined by the specific biological and environmental friction required for it to reach